Good afternoon to everybody, l-wara l-ofsenar tajjeb, jina Dr Mark Xuereb, l-lum ħanibdow sensiela ġdida, sensiela live fejn intkom tistgħu issaqsu xi domandi, tistgħu forsi għandkom xi dubi fuq xi mediċina, fuq xi trattament, smajtu xi ħaġa ġdida fuq l-internet, xi riċerka, xi ħaġa fuq is-social media. Iva, hawnhekk jiena lest u sa nwiġibkom. This live intervention is going to be open for everybody. We plan to do this on a daily basis, hopefully, and also we plan to help you out with your daily problems or needs. Comments, suggestions, questions are welcome. Today I wanted to talk a bit about the benefits of TMS. But what is TMS? Transcranial magnetic stimulation is one of the latest technologies, one of the new technologies, which we actually use for a number of disorders. Let me explain. In the past, we used to think of the brain, up to 50 years ago, 40 years ago maybe, as a petrol tank, which meant that chemicals were lost, chemicals were perhaps diminished, or chemicals weren't being produced as often as they should. So what people used to think was quite rightly, is that in the case of depression, for example, you take 4 pills, 3 pills, 2 pills to top up, so to speak, the contents of the brain. And we used to speak of serotonin, of dopamine, of norepinephrine. We used to speak of growth hormones and other such neurotransmitters. Fast forward 50 years and we've changed the way we treat the brain. The brain now is treated from 3 angles. The first one is still chemical imbalance. The second one is repairing the nerves. Maybe not everybody knows that the brain has neurons, nerves, and there are 100 billion neurons, stars in the skies above. So we have 100 billion neurons, and then we have switches which connect the nerves. And we have 100 trillion switches. And the beautiful thing is that these nerves, these switches, are all the time connecting, reconnecting, connecting, reconnecting, connecting, reconnecting. When we learn something, when we remember something, when we take some poisonous substance or something which is not healthy. When, for example, we consume toxins like alcohol, like cigarettes. Hello Jacqueline, hello Abigail, hi Shani, Shanice, good afternoon, welcome, you're welcome to ask questions. I'm trying to explain the brain, how it works. I'm trying to explain the 3, as it were, systems of the brain. So we said the chemicals, that's the first thing. The second thing is the nerve system, the network. And the third thing is, or are the switches, synapses. So this is in a state of dynamic flux. So it's all the time connected. It's all the time being reconnected. All right. So when I learn something, for example, I get a new contact being formed or a contact being removed. The problem is that when there are too many contacts coming off or too many contacts forming, that is when the problems arise. And this is so important that Professor Tim Crow from Oxford University actually said or thinks that one reason for schizophrenia, hello Rachel in the meantime, good afternoon, is in fact too many contacts when you are in the mother's womb. So these contacts are dynamic. These contacts are all the time changing. These contacts are in fact what makes us. So these contacts are our life, our emotions, our feelings. You could say, for example, that if I remember something, there's a switch, a new switch form. If I hate something or I feel bad about something, some switches could be formed or broken down. And this process, contact forming, contact removal, has a name. And the name is neuroplasticity. What is neuroplasticity? Neuroplasticity is that process by which new contacts are formed or removed. In other words, my network in my brain is continuously changing. And that network has a name. And it's called the connectome. This is an American term, connectome, connections, and it actually underlines the importance of the brain. The brain is not a static organ as we used to think in the past. Hello Krista, hello Rachel again. The brain is actually, if you like, a dynamic, plastic organ. Plastic, not as in plastic, the material, but plasticity is that process by which things are changing. So neuroplasticity means the process of nerve changing. As we said, forming new contacts, forming or removing the contacts. Thank you, Ray. Thank you, Krista. So back to the idea of neuroplasticity. When we take pills, in a way, they do help to encourage this contact forming, contact breaking. Hello, Elton. Good afternoon. Welcome. You're welcome to ask questions, and I'll try my best to answer them. So, this is the problem when it comes to brain health or ill health. We all want things quickly, but unfortunately, the brain doesn't have a quick fix. Remember what I said before, it's about switches forming or switches disconnecting. And it's not one switch, it's trillions of switches. And it's not one nerve, but it's billions and billions and billions of nerves. And why is this important? This is important because when people come to see me, when people come to see us, everybody wants a quick fix, and I don't blame them. But it takes time. Think of your muscle growing. It does take time to build on itself. A baby takes 9 months to form. So these are all, so to speak, an interaction. Thank you, Shani. Thank you for the compliments. Thank you. Thank you very much. Hello, Caroline. Good afternoon. This is a live session, one of the first live sessions where I'm giving free advice, and I'm talking about the brain. Hello, Becky, as well. Good afternoon. So, chemicals, wires and switches. Those are the three things which are all the time changing, and this is why it takes time. Therapy changes the chemicals, the wires and the switches. Medication changes the nerves, the wires and the switches. A social, healthy lifestyle changes the wires, the nerves and the switches. So you've got to think about the brain as a dynamic organ which is very sensitive to all these treatments. But be careful, because as far as the brain is concerned, it's not only sensitive. Hello, Caroline, as well. Welcome aboard. So it's not only about the good things, the bad things can affect as well. And what are the bad things? I was saying before, so pollution, cigarette smoking, passive or active, drugs, and yes, even marijuana. We can talk a bit about the marijuana, because that's quite a hot topic at the moment. Alcohol, eating too much, being overweight, many studies. So let's go through these one by one about these sort of poisons. Let's call them poisons. Number one, pollution. There's lots and lots and lots of research to show that the exhaust, the emissions from power station, from vehicles, has a lot of heavy metals, a lot of metals or substances which are inhaled and go directly into the brain. And they help, unfortunately, to break down those contacts, or they don't allow the changes to happen. For when, for example, I would be learning the names of a country, the capital city of the country, for example. So where does this go? So this goes on 4 levels. First level is the pollution which you breathe directly. That's important. The second type of pollution which you could have is the pollution which I get from noise. Hello, Sergey. Good afternoon, and thank you for joining. You're welcome to ask questions. This is a live session today, this afternoon. It's the 25th of July, and it's 4 minutes to 4 local Malta time. Welcome. So, we were talking about the four factors. So one is the direct inhalation of pollution. There's other types of pollution which can affect mental health. Noise pollution. That's why it's so important to have your downtime. So important not to have so much noise, to close the windows, have double glazing. Light pollution is another big one which is affecting mental health. That's the third type of pollution. Light pollution actually hinders your mood or worsens your mood, and there's again lots of studies to show that. And the fourth and final type of pollution, if you like, is the particulate solution. So not really the aerosol pollution, the exhaust, but the dust, the microplastics, the microelements which enter our system and they accumulate. Hello Marta, good afternoon. This is a live feed once again, and I'm happy to take your questions. We're talking about why the brain gets sick and how to prevent it. And we're talking about the three things: the switches, the wires, and the chemicals. And pollution, as we said, inhaling pollution, light, sound pollution, and particulate matter, very, very tiny particles, can actually get into our system and destabilize, disconnect them. So the nerves can break down. Other things, cocaine. Many, many studies done in the past on rats show that people who take cocaine, the contacts switch off completely. Now, I'm going to be controversial here, but we really need to be very, very clear about this. So first of all, any form of drug can have an initial benefit. It can have an initial catastrophic benefit as well, whether it's a legal drug or a prescribed drug or an illegal drug. That's the very first thing. However, marijuana, cocaine, ecstasy, or really and truly mushrooms, or any other drug which is not taken under supervision and for which there isn't enough evidence, can cause a lot of harm. Hello Sion, good afternoon once again, thank you for joining, and you're welcome to ask questions. So, what happens with these chemicals? When I take cocaine, for example, or I inhale marijuana, initially I'm squeezing that lemon. I like to compare the brain to a lemon. So I have a lemon and you squeeze it and you squeeze it. What happens? The juice comes out, and that's a good thing in the beginning. But the more then you start taking, you squeeze that lemon more. I'm saying this is usually what happens. To the point that you squeeze to get the same effect of euphoria, relaxation, more self-confidence, better mood. But you squeeze to an extent that eventually those wires, remember the wires I said, break up. It's like having holes in your petrol tank. And that lemon breaks up into shreds and your brain is punctured. So be careful. This is not about taking risks. There are people who even after the first dose of a drug can have a catastrophic effect, and yes, people can die. In the 80s we used to say, the more you take, the worse you are. Today it's got nothing to do with it. You and I can take the same type of drug. You could take it every day, every hour if you like, and I could take it once every 10 years, for example, just to exaggerate. It could cause more damage to me than to you because of my genetic sensitivity, my makeup, my overall health framework and makeup. So think about that. This is quite important. I always advise, and we always advise as professionals, that I'd rather not get too close to the fire, because if I get too close to the fire, obviously the chances are I'm going to get burnt. Cocaine, high blood pressure, heart attacks, strokes, palpitations, arrhythmias, missed beats of the heart, sudden death. Yes, I've seen people with sudden death. I remember a patient came in England, a casualty where I used to work. Don't want to sound gory, but his finger was nearly cut off. Very bad wound, very, very bad cut. He wasn't feeling anything because cocaine is an anesthetic, yes. However, the damage it causes, the repercussions it can cause, can lead you to a psychiatric hospital. You might eventually burn out from within. So it can have pretty nasty consequences. Let's not forget the money. This can have catastrophic consequences. Relationships can break down. You can fall out of work. Problems with loan sharks, criminality, homicide, suicide. We haven't spoken about suicide. So this is quite important. These things can actually happen. The next thing which can happen is also the consumption or the damage with respect to marijuana. Now, let me be clear. Marijuana has a number of uses under supervision and with dosages which are advocated by dosages which are advocated by research and good research. Why is medical, let's be clear, let's classify medical marijuana used? What is it used for? It's used for multiple sclerosis, which is a condition where the nerves in the brain get plaques, they get like a hard cover, and it can cause problems with your eyes, your ears, problems with epilepsy. It can cause problems with your bladder, with your motor, coordination and memory. So that's one use, a recommended use. And by the way, recommended uses by the Royal Colleges abroad. Hello Tony, good afternoon, welcome. You're welcome to ask questions. This is a live interactive session, the first one. And I'm trying to explain the problems with the brain. Again, we're repeating, stop thinking of the brain as just chemicals. There are wires and switches. There are nerves, 100 billion nerves and switches. And there's a dynamic situation. Marijuana, medical marijuana, advocated in, the best evidence is advocated in number 1, multiple sclerosis, 2, epilepsy in children where other pills would not have worked. And number 3, terminal cancer. Terminal cancer where there are people who unfortunately are on the deathbed, they cannot eat, they're too tense, and this relaxes them and helps them with their appetite. So that is the medical aspect. The fai da te, do it yourself, is certainly not advocated because it causes more harm than good. Now let's talk about marijuana, hash, cannabis. That is CBD, so the medical marijuana is predominantly cannabidiol, CBD, and the THC, okay, is usually the psychoactive, as it were, component in hashisha. Now, hello Marta, thank you very much. There we are. Thank you for saying I've benefited from TMS a couple of years ago. Thank you, Marta. Thank you very, very much. That is really kind of you again. That this shows, and in fact, thank you. And this actually shows that, hello Mariana, this shows that TMS works because it closes all those 3 things, the chemicals, wires and the switches, but more of that in a very short while. But back to marijuana. So marijuana, the one you smoke or you cook or you drink, okay, remember that marijuana is a very versatile chemical. The one which has THC can actually, eventually, inevitably, in my experience and my colleagues, can cause 2 things. 1, it makes you fat. And number 2, it slows you down. So the engineer who was a high flyer is now stuck to his bedroom playing games. The athlete just ends up becoming overweight and very depressed. So be very, very careful. By the way, let's not forget, hello Justin, good afternoon, thank you for joining. Once again, you're welcome to ask questions, interact. This is a free session for advice, and we're talking about the brain and about the 3 things, which is wires, switches, and chemicals, and we're talking about the damage which marijuana causes. Inevitably, I challenge anybody on this. I still have to see one person who takes marijuana, who doesn't put on weight, and whose energy doesn't diminish. Now, obviously, if I'm a high flyer, if I have an intelligent brain, and I can become an engineer, for example, the risks are that if I smoke, I won't become an engineer. I'll still be functional. So it's all about what you want. Bottom line, marijuana is associated with an increased risk of suicide, homicide, self-harm, depression, psychosis, weight gain, impotence. It alters your hormones. Men grow women's breasts and get the shape of a woman's body. Pretty serious stuff. Some people say, yes, it helps me to relax. The evidence is not very, very, very strong. And where the evidence isn't strong, doctors err on the side of caution. Not judging you if you take marijuana, not condemning you, not criticizing you, but you deserve to know the truth. And the truth from good science, not hearsay or social media, and the truth which is actually the latest evidence. This idea that CBD is safe and THC is not, that again is very debatable as well. So those are the only 3 uses of marijuana, as I said, for medical marijuana. Epilepsy in childhood, where pills haven't worked before. Secondly, multiple sclerosis. And number 3, terminal cancer. So what else can cause damage to this network? Alcohol. Maybe not everybody knows that on the 10th of January 2022, something extraordinary happened in the world. No, it wasn't because of COVID, not related. But during COVID, researchers did a lot of research on alcohol. And they said, what is the right amount of alcohol to consume for a man and a woman in a week? Before COVID, a man could take 21 units a week, not all together, but 21 glasses of wine, 21 shots, and more or less, depending on the alcohol content, more or less about 16 normal strength lager, more or less. And the woman, because of her hormone profile, could take 18 units more, if I'm not mistaken. Fast forward, during COVID, research was done, they pulled all the data. After COVID, on the 10th of January 2022, a very important piece of research came out. And the research said this, that the recommended amount of alcohol for a man is 0. And the recommended amount of alcohol for a woman is 0. In fact, they state that no amount of alcohol is recommended anymore. So you will appreciate, you will understand. It is quite important, it is very, very important in fact, that we take note of the latest research and we quote good, solid research. Okay? Jessica, how are you? Good afternoon. Thank you for joining. Justin, Rebecca, hello. Hello. Rachel, hello. Sion, hello. Krista, once again, thank you very much for staying here. And Shanice, hello. How are you? Hello, Rita. Good afternoon. Welcome. This is a live session to answer your questions. Today I'm talking about the importance of taking care of our brain, and it's not only about chemicals, it's about wires, switches and chemicals, and how TMS actually works. So as I was saying, look at the evidence, get the good evidence. So pollutants, alcohol, drugs, those don't help. Hitting your head, having problems, not eating well, and this is another big issue. The eating well, remember the brain, the nerves take time to connect and reconnect, reconnect. You need to make sure, this is very, very important, that your diet is followed regularly. So, the latest evidence, taking magnesium, turmeric, a probiotic, speak to your doctor about this is actually quite important because the microbes, the bacteria in your gut, in your bowels, all right, which help break down the food, if those are the bad bacteria, they can actually release poisons which go into your blood, into your brain, and they can break down this connectome. So think about your diet, your exercise, meditation, prayer, a hobby, avoiding the fast foods. Again, lots and lots of research, not only from the cardiovascular point of view and from the blood vessel point of view, but there's a lot of research that a healthy diet promotes blood flow, and if you have a good blood flow to a brain, therefore you have a healthier, longer physical and psychological health. Elaine, hello, good afternoon, merhaba. Thank you for coming. This is a live session today where I'm trying to reinforce the importance of treatment. So, things to get you better, therefore: tofu, Mediterranean diet, exercise, meditation, prayer. And these are very important. The trick is, and this is what I find with our patients, it's difficult to stick to the plan. People want it all, unfortunately, as I'm saying. The brain takes time to connect and reconnect, so think about that. Next level of, as it were, information is, to take this to the next level, to keep these contacts healthy, to keep that brain fluffy, if you know what I mean, all right? The way we keep that healthy and the constant state of connecting, reconnecting, we need to take care of our health. Now, if there are problems with our mental health, classically depression, because depression is the most common psychological problem in the world. With anxiety, it's estimated that there's about 200 million people who are depressed and anxious at any time. All right, it makes sense to treat this disorder. So, first of all, the very first thing which I think is important to keep in mind is that the healthy lifestyle should never be underestimated. One, remember, I want to make contacts and healthy contacts. By the time you leave this live session, your brain would be rewired differently than when you started. So, the healthy lifestyle. 2, a mentor, a guru, somebody who can direct you, somebody who can help you, somebody who can tell you, listen, this is maybe coming from here, this may be coming from there. Sometimes therapists can give you help or advice, but sometimes they guide you so that you reach to a certain awareness yourself. Therapy works, therapy takes time to work, and again, think about the reason why therapy takes time to work, because it's all about those contacts. The third thing, medication. Now, be careful, please don't stop your medication without supervision, don't change your medication without supervision, do not go and try and borrow your grandmother's medication. Matthew, good afternoon. Thank you for joining. This is a live blog today. We're trying to answer certain questions about the connectome. Please feel free to ask. Rita, hello again. Elaine, once again. Thank you for joining, Krista. So the brain needs magnesium and turmeric, the spice, to rebuild the basics, the building blocks with a healthy protein diet, Mediterranean diet, to reconnect those wires up here. So sometimes you might need some medication. The medications, the antidepressants, for example, or antipsychotics, for example, help to restore chemical levels. And it's not only about serotonin or dopamine, those are only two. There's about 36 neurotransmitters. So this is a whole compendium, a whole collection of these, if you like, chemicals. So go to your doctor, speak to your doctor. The problem with pills is that sometimes they have side effects. The problem with pills is that they could be labeled as an antidepressant, but they could have many other uses. Bottom line, speak to your professional. Yes, of course, please Google and check and ask ChatGPT, but be careful, because you really want to get a professional who has experience in the field, who specializes in the field, who studied and uses these treatments on a regular basis. Talking about treatments on a regular basis, this is what I wanted to talk about. The next big thing is neuromodulation therapy par excellence. And there are various types. The therapies we have at the moment are either shock therapy, electroconvulsive therapy, where people are given an anesthetic, they're given an electric shock. It is a bit tough and quite dramatic sometimes, but it actually does work. It actually works, it actually helps. Obviously, there's the risk of anesthetics, there's the risk of not being able to drive after, there's the risk of obviously aspirating means, which means that you could get some food out of your stomach, it could go into your lung, and that has a certain problem, morbidity and mortality. So it's not without its risks. However, ECT does work, shock therapy. It's had bad publicity, but we do use it sometimes. I'll give you an example. Somebody who thinks and can't get out of an experience because of trauma. One of the side effects of ECT is that memory lapses. So that can actually help, but you wouldn't give ECT to somebody who's studying for their exams for obvious reasons. The next upgrade to that is, in fact, magnetic stimulation therapy or transcranial magnetic stimulation. What is TMS? TMS is something which has been established in Malta for the last 7 years now, or more, what am I saying, 2015, 9 years even, time flies. So TMS is really about working on those wires, switches, and chemicals. So if you think about, imagine this is a nerve, okay, imagine that's a nerve, and I put a magnet on my nerve, okay, let's suppose, I'll show you, exactly, let's suppose I put my magnet on the nerve, and the magnet goes on and off, and on and off, and on and off. We know from a process called electromagnetic induction that changing of magnetic fields induces a current in that wire. This technology is used in MRI, magnetic resonance imaging, on a different plane, because the magnetic field makes the water in the tissues. Remember, the human body has 70 to 80% of the human body is in fact water. Those molecules oscillate at a particular frequency, give off a magnetic field, and you see a picture. TMS, transcranial magnetic stimulation. So transcranial through the cranium, the skull, magnetic stimulation. What am I doing? When I put the magnet on certain parts of the brain, and there are 8 spots, we'll talk about them in a minute, I'm stimulating that nerve. And if you remember, those wires which are disconnected, we either induce them to connect. So if they're disconnected, we make them connect if the magnet is above, or depending on the settings of the magnet, of the neuromodulator, the machine, we can get certain nerves to disconnect. So you'd appreciate that they can either connect or that they can disconnect. And very soon now in the clinic, I'm going to be repeating this explanation to many, many, many people here. Because this is something novel. It's not shock therapy. It's not pie in the sky. It's not charlatan speak. It is evidence-based therapy. It's not a therapy which just started. The Romans, for example, used to use the torpedo fish, which is a fish which discharges an electromagnetic field on the head to stop migraine. And it did work. It did work. Fast forward in the 1800s, there's a lot of research. The modern TMS started more or less about 50 years ago in the 80s and the 70s. So this is a safe, effective therapy. There's no side effects at all, The way it works is this: you come in, you're going to be screened for really one contraindication. There's only one real contraindication, and that is electromagnetic material in the head. If you had a head injury or an operation, you have a piece of metal in the brain which is ferromagnetic. In other words, it can be magnetized. Okay, and the problem with that is it can either move or get heated up. But again, there are things to circumvent this, to avoid this. In the past, we used to speak of epilepsy as being a contraindication. It is no longer a contraindication. Again, I always like to tell you, please speak to experts. Speak to those who have experience in the field, those who are trained in the field, those who are established in the field, and those who have a certain amount of experience. In Malta, there's one clinic, only one clinic, the TMS clinic, and this TMS clinic has been trained by those people who invented TMS, by those people who started the first trials. For example, you can Google Professor Mark Xuereb from the Medical University of South Carolina, one of my mentors. He's the man who started the first research on TMS. If you go on the TMS Malta Facebook page or website, you will actually see pictures of the team with people like Sir Tony Barker. Tony Barker invented the machine. People like Colleen Hanlon, who is going to be delivering a talk in Malta. She is the inventor. She invented a protocol, a magnetic treatment for addiction. Mark George for depression. And other people like Mohammed Abdelghani, Linda Carpenter, David Blumberger, Jonathan Downer, another very illustrious person who actually trains the team on a regular basis. So we're very lucky and very blessed that we have first-hand information, top qualifications, a lot of experience, and we are making a lot of improvements to people's life. Remember, we don't strive for perfection, but we give people the tools to repair that connector. And what happens? So you're assessed, you're screened, we check how many coffees you're taking, we check if you take drugs and alcohol. As I said, the only really contraindication is having a metal implant, like a cochlear implant, which is a little machine which goes close to the ear for hearing, or a metal plate if you would have had an accident, for example, from falling with a motorbike. And there are treatments which last 3 minutes, and this is almost surreal, almost like but it actually does work. So think about it, and look up the information. So you sit down, there's the team, you're relaxing on a comfortable chair. We put the magnet on one of six points, depending on what the problem is, knowing this connector, where the wires are disconnected, or they're crossed, or over-connected, or connected wrongly. And for those 3, 10, 15, up to 20 minutes, sometimes even half an hour, depending on the case, you're going to watch television. You're going to think, for example, about your cocaine addiction. And as you're doing that wire, that defective wire, which tells you, I want cocaine, I want cocaine, I want cocaine, repairs itself. But you need to do a number of sessions. For example, the Colleen Hanlon, this lady's expert from North Carolina in America, who did all this research, a personal friend of ours. We're very lucky. These are all in the families. That's where we're actually making history in Malta. And that is quite remarkable, and we're humbled and honored that in the tip of the south of the Mediterranean, we fly the TMS flag, and we are mentored by the creme de la creme. So back to cocaine. Suppose you take cocaine, you sit down, you watch television, you think about the cocaine, or you're actually shown on the screen cocaine powder. The idea is to trick you, to entice you, to tempt you to take it, to get that switch to suddenly start to connect or to talk to each other. That switch then is repaired at that time, and the time as you're actually being tempted, by the magnet. The magnet dampens that contact, and therefore you crave less. Let's be clear, this is a multimodal treatment. That means that we work on 4 pillars. So the TMS, we work on lifestyle changes, having a mentor, and sometimes some medication or some vitamins. It's quite important that there's no quick fix in life, unfortunately, and if only. So think about it. The people over there, out there, once again, hello Rita, Elaine, Matthew, Krista, Rachel, Rebecca, Sion, Elaine, did I mention Elaine? Yes, again, Shiny, Shanice as well, thank you very much. So there is treatment, there is new technology, and there's more, and there's more, and there's more, but I won't tell you yet. Watch this space. New novel technology only in Malta. We're very privileged and humbled and honored to be able to pioneer the latest in mental health. There's some new technologies coming out. We're getting training for it. I'm not going to tell you yet, but believe me, this is actually going to help. So TMS is safe and effective. It's non-invasive. You can do it as an outpatient. It's good for pregnancy, for children. We've had, for example, children who are socially phobic, anxious children who don't study well or cannot study well, children who are not secure, insecure, employees, managers, lawyers, judges. We've had priests, we've had workers, laborers, we've had housewives, we've had headmistresses, we've had, in fact, people from all over the Maltese and Gosliston social sphere. They are better if they follow the 4 foundation, the 4 pillars, those 4 foundations, one of which being TMS, to close those switches with therapy, with medication, and also with lifestyle changes, then there will be a change. So more information is out there. Ask, check, but I ask you finally to check with those people who have trained in TMS, those people who have experience in TMS, and those people who have the qualifications in TMS and who are mentored by none other than the best. You've all been a wonderful audience. This has been the first of a series of sessions. We'll be publicizing it a bit more often to make sure that we give you the right time. And please, please, please do not hesitate to put down your questions, to put down your comments. If you agree, you disagree, we can debate, it's no problem at all. Or if you have any issues with your mental health or that of your loved ones. Remember, there can't be health without mental health. Let's get better. You now have the tools to resolve a crisis. I really, really wish you all the best. Thank you, Erica. Thanks, everybody. Have a good afternoon. And once again, take care of yourselves and of those around you. Bye-bye.